24 million American children under the age of 6. You know how many have to be cared for by an adult all day, every day? All of them. That's why childcare is so essential. America literally doesn't work without it. It's high-skilled, high-intensity work that simply can't be outsourced or automated. The problem is, right now in America, the childcare marketplace is broken, and the result is an everyday crisis for working families and a slow-motion catastrophe for the American economy. Here's the deal. In a functioning marketplace, there would be a balance between the supply, in this case, childcare providers and what they charge, and the demand, families and what they can afford. But the true cost of high-quality care is so much higher than what the market can bear that it makes the whole system unstable. Providers have to pay for fixed costs like rent, food, books and toys, and supplies. But mostly they have to pay for people. That means the only way to keep costs down is to squeeze salaries. On average, childcare workers make just $11.65 an hour, and 53% rely on some form of public assistance just to get by. Meanwhile, overburdened working families still have to stretch to pay. Infant care alone can cost as much as $24,000 a year, more than the federal poverty level for a family of 3. And all that was before COVID-19. The pandemic has devastated the industry. Costs have soared, revenues have plunged, and thousands of providers have been forced to close their doors permanently. Without action, the childcare marketplace may break down entirely. So, how do we save it? Well, fortunately, we have a blueprint, and the architects might surprise you. The United States military. Every year, the Department of Defense supplies or subsidizes high-quality care for more than 200,000 children. By treating childcare as mission essential, they ease the burden on families and providers, which makes both sides more resilient. The military views childcare not as a private need, but as a public investment. That's a model that can work for all Americans, preserving parental choice while paying the workforce what it deserves. It's the smart thing to do and the right thing to do. So if you want to throw a lifeline to working families and small businesses and jumpstart the economy, then support childcare as the public good that it is. Because the best place to start is always at the beginning.
Well, good afternoon, and I want to welcome everyone to the final in a series, a 4-part series of conversations that we've been having with those around the country who are providing childcare to our youngest children. My name is Linda Smith, and I'm the director of the Early Childhood Initiative at the Bipartisan Policy Center. And for those of you who don't know us, we are a Washington, D.C. based think tank that strives to take the best ideas from both sides of the aisle to put forward policy solutions to our nation's greatest problems. And obviously, I don't think there's any problem anymore that's greater than the issues facing our families and childcare as we come out of COVID. So what we have today is a panel of 4, the fourth panel is a panel of 5 childcare providers from around the country. We will introduce them here in just a second. But before we do that, we want to go through some things that we have learned as we have talked to parents around the country and done some actual surveys of parents. So with me today is Sarah Tracy, and she's going to be moving the slides for us. And later on, she will be taking questions from the audience and directing them to the panel as we move forward with the conversation. So Sarah, do you want to move to the first slide, please? Okay, so you just saw in the video that explains the business model that we have challenges with childcare, with the business model of childcare. We know that it's difficult for these people who we're going to talk to in a minute to balance the everyday costs of providing the service with the income that they get from our families, and that it's a constant struggle to make these things work, to make the income cover the expenses in these programs. We know that if we don't do this, that we have a serious problem, as the video showed, that the system is in danger of collapse. So as the pandemic has put a focus on childcare, we now do understand, and I think the country at large understands the business model and why it's time to look at this as a public good. So looking to what parents want. Sarah, let's go to the next slide. What we do know that parents want is essentially healthy, safe environments for their children. We also know that the price of childcare is out of the reach for many of our families. If we have been trying to dig into what parents actually can afford to pay for childcare, and the chart shows you the response to the latest survey we did in December, and it basically says that 67% of children were reporting that they could pay no more than $200 a week for childcare. That is bare minimum when it comes to making these programs sustainable. So we know we have a challenge in terms of what parents can afford to pay. The next slide, Sarah. We also learned that parents have many challenges in terms of how they have made it work in terms of getting childcare and paying for it. Many have reduced their hours to make childcare work. Some work overtime. Others have taken on second jobs, or they have changed jobs to have more flexible hours. And then 21% of the parents have actually quit their jobs to stay at home with their children simply because they couldn't afford. They did the math and they couldn't afford to go to work. So these are challenges, as I said, for parents. Next slide, Sarah. We asked parents what they were looking for in their childcare arrangement and found that a plurality of parents want center-based care. That's, it's a very, makes a lot of sense to our audience. They are split, however, between programs that are affiliated with a faith-based institution and those that are not. And we do have a provider who is operating a program in a faith institution with us today, and we hope to hear more from her. Let's go to the next slide. I think this is a word display of what parents have been telling us they want. And as I said earlier, they want to be able to trust their provider. They want safety, quality, they want reliability. And something else we're focusing in on new since the pandemic is looking at flexibility. And it is very hard to be flexible and make the numbers work in childcare. So let's go to the next slide. Parent preferences. Most parents report that they are not making any compromises when they're selecting their childcare center, and that's actually a good thing. However, a quarter of parents reported that they compromised on either cost or flexibility, and those are, as I said, cost and flexibility are two big issues for our parents. Next slide, Sarah. It is well known that parents need care for a variety of reasons, and I think that this is where we sometimes get confused because childcare, and I say this as often and as frequently as I can, is a work support, but it's also an early learning situation for children, and it does help children learn and be ready to go to school. We simply can't separate childcare and early learning, and I think sometimes some people in the public think that those two things are separate, and we're going to talk about those as we move on into the panel. In this slide, we looked at, this is sort of highlights what we have found in our study of 25 states, where we have been looking at the gap between the supply and the demand or potential need for childcare. And in all of the states, we found a gap. There simply isn't enough childcare out there to meet the need. Although it varies across the country right now in 30, we've actually done an additional 8 states that are not shown here yet. But in all of the states where we've done this gap analysis, the gap is around 31 to 32%. In other words, there's not enough care in this country for all the parents who need it. And we're gonna have to address that as we move out of COVID. So to the next slide. I think we have made significant investments in this. We're gonna talk about some of these, especially during COVID and since the CARES Act put dollars out there, and BPC has been tracking the use of some of this money. We also have been paying attention to the PPP loan, the Paycheck Protection Program, and how many providers are actually taking those loans. And you'll see there that a very small percentage, less than 1% of the funding went to childcare in this country. The loans simply weren't accessible to a large part of the childcare community. And to the final slide. So I think the challenges that we are facing, and we hope to get comments from these ladies on how we move forward. It's pretty apparent that we have challenges, especially with small businesses. And what we want to talk to these ladies about is what did they think would be useful? What types of support did they need? How are childcare workers and the children they serve faring as we keep going on and emerge from this crisis? And then what are the policy solutions that we can all talk about that can help us fix this imbalance between the supply and the demand for care in the country? So we're going to move into our panel discussion now, and it gives me a great deal of pleasure and honor actually to introduce our panelists today. And I want to say in advance, thank you so much for taking time. We know you all are running programs right now and that this is a sacrifice. And we really do appreciate you making the effort and the sacrifice to talk with us today. So the first participant is Jessica Quinn. She is the owner-director of Happy Hours Learning Center in Aberdeen, New Jersey. And welcome, Jessica. We have Rita. I'm going to say this badly, I know Rita, but Rena Oheno Omako. And Rita is the executive director of the Learning Hive in Lawrenceville, Georgia. Welcome.
Thank you.
Next, we have Angie Paulson, director of Cuddlebugs Daycare in Missoula, Montana, my home state. Yay.
Hey.
Welcome, Angie. Next, we have Nuria Salzbrenner, owner and director of Birdie's Nest Child Care Center in Davenport, Iowa.
Thanks for having me.
And finally, we have June Chiletto, director of the Yates Baptist Child Development Center in Durham, North Carolina. And thank you all again so much for joining us. We really appreciate it. I want to open by going around and asking you all to describe your businesses, if you will, very quickly. And how has your business been impacted by the last year and what's gone on with the COVID pandemic? So I'm going to start first with Narita. How about you?
Hi, my name is Nuria Salzbrenner, and I'm the owner and director of Birdie's Nest Child Care Center in Davenport, Iowa. And we are a mid to large center. We serve a little over 100 children, ages 6 weeks up until we have a school age program. So we go until the end of elementary school. And the pandemic has been really hard for us. It's been tough. It's been challenging. Lots and lots of obstacles, as I'm sure most of you know, kind of thrown at us every single day that we've had to overcome. There's been staffing issues. There's been supply and demand issues. There's been financial issues. So it's definitely been a roller coaster.
Maria, how are you operating at full capacity right now?
Right now we are, yes. We had a dip kind of when the pandemic started in 2020, like March and April, May. We had a large dip. We kind of struggled through the summer. And then when fall, I'm in Iowa. So Iowa kind of started reopening a lot of things. And so our parents were going back to work. So we kind of leveled back out in the fall, and we've been able to maintain our capacity throughout the rest of the pandemic.
Okay. Angie, how about you? What's going on with your program in Missoula?
Well, I'm the co-director and co-owner of Cuddlebugs. We serve 31 children from 6 weeks to 6 years. And we really had we went to about half capacity for the first month and a half, maybe till the end of April, and just served essential worker families. And partly because our governor was mandating that was what child cares needed to do, was only serve essential workers. So we did that. We really didn't have a huge issue. I mean, we did get a PPP loan, so that helped.
Oh, that's great.
We had parents who would pay half their tuition in order to keep their spot if they were willing to work from home. So we fared fairly well through this pandemic. We aren't up at full capacity currently, only because we have a lot of infants turning 2, so we have to leave room for those kids to transition into another classroom. But we will be back up to our full capacity by fall.
When you were only serving essential workers, what percentage of your enrollment would that have equated to?
We had about half of our families that we were serving at that time. We did lay off 2 employees until we got the PPP loan, but it was for a very short amount of time. We pretty much were back up to full staffing by May.
So you'd say the PPP loans were a good thing for you, right?
Absolutely.
Rita, tell us about what happened to you during this. Rita, you're in Atlanta, right?
Yes, we're in Atlanta. So when COVID hit, because of a lot of uncertainty, we actually closed down completely from mid-March and reopened back up first week of June is when we reopened back up. We have 2 small locations. One of them is licensed capacity for 33, which serves infant, toddlers, and preschoolers. And then our other location has a capacity for 55, which is a school age program. So reopening back up was difficult. Lots of uncertainties, lack of direction, because this was new to everybody. Nobody knew how to deal with COVID. So once we got some direction from the state as to how to operate in COVID, we reopened back up, and it was tough. It was and it still is, it's a very slow trickle in for us. We reopened back up. Pre-COVID, we were about 70% capacity at both locations. We reopened back up at 30% capacity, which was very tough. I mean, and with we did get a first round of PPP loans, so that helped us, kind of slowly bring our staff in, because we didn't have the children to bring everybody in at the same time, at once. So we kind of slowly ease everybody back in. Of course, I lost staff because of that, because they needed to work, and it's just been a roller coaster. And right now, I would say, I kept telling myself it's just like starting all over again after being in business for 5-6 years. So it's.
Did you lose your staff, some of your staff permanently, or did they come back?
Yes.
And it was just.
Yeah, I did lose some permanently because they had to find employment elsewhere while we were closed. So yes.
Okay. Jessica, you're in New Jersey. What happened with you?
It was tough. The tri-state area was hit pretty hard. So we did wind up closing for 4 months. We closed mid-March and we reopened the beginning of July. We're a nice medium-sized center. We're licensed for 64 kids, 6 weeks to 13 years of age. When we were shut down, we were at a little over 80% capacity. We finally did open. We actually attempted to reopen a few times, but we just couldn't get enough enrollment for it to kind of make sense for us. And then once we did apply for PPP, and once we got approved, that really helped us out. So we were able to bring back all of our staff, even though when we reopened, we were only at 30% capacity. Wow. It helped us significantly, and it helped us to keep our staff, because the other thing in New Jersey is unemployment is paying probably more than what we were paying our staff. So, that was a struggle too. They were nervous. They weren't really in a hurry to come back. But, getting the PPP and being able to pay everyone full time, and, that's really helped us.
And June, how about you down in Durham?
Yes, good afternoon. Thank you for the opportunity to share. We are a faith-based program. We're a mission of a church. When we're full, we have 64 children. With COVID, actually last March, I guess it was, when COVID first happened, I was all in favor of closing. I didn't think it was ethically or morally right to ask people to work in these conditions and to put our families at risk. But then sadly, I discovered that the majority of our staff wanted to stay working, and this is not a good reflection on childcare, but the reason they wanted to stay working was because they couldn't afford not to. And as we're a faith-based program, we're a non-profit, so they weren't eligible for unemployment benefit either. Plus, if we'd closed, they would have lost their health coverage, which is a part of their job. So we lost maybe 3 or 4 teachers who, because of health reasons, chose not to work, but the majority wanted to, so we stayed open. And in the beginning, we only served essential workers because that was the state mandate. So we went full when this first happened. We had 52 children when this first happened, and we served 11 children of essential workers through till maybe May or June, I think. And then it gradually increased. We're not at full capacity. We're running about 45 children out of what we should have is 64. We have had a PPP loan. The church applied for that for us because we're the same federal tax ID number. And they've now applied for a second one and got it. This is obviously invaluable. The first one allowed us to pay our staff for 16 weeks, including benefits, which was a huge, huge deal for us. And now they've applied for a second one, which has been approved. So it has been, the whole situation has been challenging, yes. It has sort of caused, I guess, stress on all of us because there's always this fear that you might, catch the virus or get sick in some way. So yes, it has been a challenging year. On the other hand, I think that it's also been a year where we pulled together, and because of that, I think that we've become stronger as a team.
Mm. You mentioned something that I'd like to hear the rest of your thoughts on, the stress issue. We've heard that stress has been a real concern in, not just for families and children, but for your staff and for yourself. I mean, you balanced a lot, I'm sure, during this time. Can you talk about what you're seeing happen with any of those, with your staff, with the children, with the parents? What are you seeing out there right now? And let's go back with Jessica. Let's start with you.
I think, with the children first, they came back after the first 4 months and they were just so excited to be back. And it's kind of hard to tell, with little kids, but I mean, they just, getting back into routine, seeing their friends again. But I can say now that as we've gotten past a year and over a year into this, any families that are starting to come back now, or children that are getting ready to start back to childcare, they're really having a hard time with separation anxiety. They're, being away from their parents because they went from maybe, being in childcare full time and spending more time with us to spending all of their time with their parents. And now, they're really struggling socially and emotionally. And then it's causing the same, I think, for parents, because now parents are really struggling with, how difficult it is seeing their children, struggle so much emotionally being away from them after being with them, for so long. Mm-hmm. I think that, just in terms of the children and the parents, that I think that's really hard. And I'm noticing that people are looking for less childcare in the term of where they would have been full-time before. They're finding, ways to do only 2 or 3 days or ease the children into it because they are so concerned with their child's, emotional well-being now because there's been all this time away from, this environment.
How about your staff?
In the beginning, it was tough. Some, I have some staff that had some health conditions and they were really nervous, but they were really also ready to get back to work. I'm very fortunate to have amazing staff that really love their jobs. And they really miss the kids. Mm-hmm. While it was nice because we're a 12-month program. So, while it was nice to be able to have some time with our own families, which we don't usually get, mm-hmm. They really missed their kids and the school and, being at school and just everything about it. But I think they're struggling now, too, with helping the children that are coming back after such a long break and, being able to, find the right strategies to work with parents and the children and helping everyone along with the, the emotional strain that this is having on them.
Rita, what have you seen in your program?
For me personally, there's been a fear from the beginning One of my best workers, who is actually the director for my other location, she still hasn't come back. She's working from home now because she's doing our curriculum. She's always been our curriculum coordinator and everything. So we kind of worked with her because she's of value and want to keep her. So she's working from home now, but she had a baby in June in the middle of COVID. So having to deal with hospitals and things and everything she had going on, it's put a real fear in her, and when she speaks, and I'm getting a little bit emotional, she talks about it. People died, Miss Rita. I don't know if I can, get back to what it used to be. So for me, I'm giving her time, just take your time, work yourself whenever you're ready. You have a place at Learning Hive. But I mean, I have teachers who have spouses with pre-existing conditions. So every time they're coming to work, there's that fear. What if I catch it and I take it home? So it's, and for me as a leader, I have to deal with my own challenges. And then I have to make sure I'm taking care of my staff and whatever. And everybody is at a different place, a different state of mind, but everybody has that underlying fear. I mean, we come here and we do our best for the children and families we work for, but it's like, okay, what if I forgot to clean that table? What if somebody skipped washing hands? It's just, in the beginning, it was really difficult, just, kind of going through that process of running a childcare business with, children, parents that are out there, and sometimes you don't know where they've been. They're bringing their children in. We don't know. So the stressors are there for everybody, and for us as leaders, I think it's even more because we have to deal with the financial burden, thinking of all those things, and then making sure we're taking care of our staff emotionally, mentally. It's difficult.
As managers or directors of programs, I think you have that added stress of of what we led into this with, of the business model, and making the balance between, what your income is and what your, what's going out. Angie, can you talk a little bit about that? What were you experiencing? I mean, you must have had a lot of additional stress because you're trying to balance the books, take care of your staff, take care of children who are, under stress. Talk to us about that.
It was very stressful. You never want to be the person who says, I'm sorry, you don't have a job anymore. So luckily our staff was really great about, we said, this is what's happening. We're going to be, half capacity. Who is interested in going on unemployment? Who wants just reduced hours? Who wants partial hours? And, everybody did what they needed to do for themselves. And when it was time to come back, everybody came back. And so that was great. I mean, that PPP loan, as mentioned with other people, it helps you pay them what they were making before. And unemployment was certainly paying them more, but they chose to come back, which was great. And we got a lot of grants from the state of Montana as well that helped us. We did end up having to close, oddly enough, just the infant room twice due to COVID. The toddler area remained COVID-free, but we had 2 children under the age of 1 contract COVID at 2 separate times. So we had to close down to quarantine and, deep clean and do all of that. We paid our staff through that. We just paid them their normal hours that they would pay, which we were able to do because we got grants from the state, because that was well after the PPP loan had been used up. The kids have been really great. While they were gone, we utilized Zoom to do circle time with the older kids. The infants, we sent picture books of all of their infant friends so they could still see their friends, because infants can't Zoom, toddlers can't Zoom very effectively either, but it was fun to still be connected and still make them know we missed them. We were ready for them to come back when they could come back, and we didn't lose any kids or any families through any of the closure or any of the kind of slow down when people were staying at home.
Nerea, what was the biggest impact on you as a director?
For me, I think the stress piece is really, really huge. And I own my program, and I started my program almost 5 years ago. And so when COVID hit, all the schools were shutting down. Lots of larger centers were closing down. And we had probably 90% of our facility was all essential workers. We had tons of nurses, children. We had firefighters, children, police officers, children, grocery clerks. So I had them begging me, please don't close down, please don't close down. And I had to balance it with my staff, who was concerned as well. I had staff members with diabetes, asthma. I had staff members whose spouses, like was said, had had open heart surgery a few months before. It was very stressful. For me personally, I was worried I was going to lose everything. My husband and I started our center. We depleted our 401ks. We cashed out all of our savings. So we literally put every single thing we had into Birdie's Nest. And so for me, I was balancing health and safety, what my parents needed, what my staff needed, and also can I put food on the table for my own children? So it was really stressful. I mean, there was so many nights I just cried myself to sleep because I was balancing trying to do the right thing for everybody, trying to do the right thing for my staff, for my parents, for myself, for, the good of the community. And I think someone also addressed that it was confusing. Nobody really knew what to do. For us in Iowa, all the schools shut down. But our governor was asking us to please stay open and not to shut down. Everything was changing every other day. And, we had those same concerns like, oh my gosh, are we using the right disinfectant? Are we using the right sanitizer? Is this going to kill COVID if it's here? So just kind of balancing all of those things. Prices of items were skyrocketing. Our cleaners, our gloves, our paper products. So luckily I just told my parents, I said, I need help. If you want me to keep my doors open, I can't find supplies, nor can I afford them right now. This was before we got the PPP as well. There was no grants really flowing through. So all of my parents just went out and got as much as they could and kind of had a supply stocking party for me. Wow. And they said, we support you. We'll do whatever we need to do. So they stocked us with enough supplies to last a full 2 months. And if they hadn't have done that, I mean, I wouldn't have even have had bleach to put on anything or sanitizer or anything to wipe it with. So it was a lot. It was a lot of, like I said, crying myself to sleep at night and trying to balance everything correctly. And so we stayed open through the entire pandemic. We did have one closure, a forced closure for 2 weeks. We had an employee whose husband brought COVID in he worked in a factory. And as we all know, the factories were hit really hard. So she brought it into our 2-year-old classroom, and my daughter, who was 2 at the time, actually contracted COVID. So we had to shut down our center for 2 weeks, and my daughter had COVID. So COVID was in my house, and it was just awful. It was stressful. It was awful. It was a very, very trying time, and it still is. Now that PPP is done, there's always this looming fear of if one person in my center gets it or has a sibling in another classroom, like my whole building will be shut down for 2 weeks, and I don't have the funds to support that. So it's almost like you're waking up every day with this awful fear looming and these dark clouds of what's going to happen with COVID and how is it going to impact not only my family, but my staff and all the children that I serve as well. So it's been really, really awful.
It sounds like a big kudos to your parents. You should pass along all of our great, thanks for what they did for you. That's great.
Absolutely.
I think sometimes people don't understand how close parents get to their childcare providers. I mean, you do become part of the family for so much.
Absolutely.
June, you were in a faith-based program. Did that help you get through some of this? Was the church a part of your support system?
Yes, so this program has been in operation since 1966, and it's a mission and outreach of the church. So they are always very supportive of us. And one of the great things for us going through COVID is that we don't pay rent for our space. So, whereas other programs are paying a rent or a mortgage, we don't pay that. We do pay, utilities and the phone and the internet and those kinds of things. And so we have a sort of reciprocal relationship with the church where we maintain the space and we maintain the playground, and they support us by providing us with the space rent-free. And they also are supportive in other ways. So the program is governed by a small group of church volunteers that meet every month. They're usually people like social workers or educators or people just with children that have an interest in the program, and they meet and they make policy decisions. And then also the church leadership here, they're always supportive, but during COVID, they took to Zooming with our children. So they would Zoom story times or singing, or one of the church leaders has been doing mindfulness with the children via Zoom. So yes, they've been extremely supportive, and I think that's what's helped us get through the last year.
That's such an important thing too. You know, I think one of the things that we're really interested in understanding is sort of how people got through this and how much some of the federal support. I think, Angela, you said something about getting grants from the state. How many of you got state assistance somehow, other than the PPP loans? Did you get other things? What did that look like? Rayetta, what did that look like for you?
For us in the state of Georgia, they called it the stable grant. And basically, so long as you were a licensed childcare program, I think the first round, it was open to everybody, but the second round, you had to be open in order to get it. And I really appreciated the fact that they made the process very simple. You know, you didn't have to, unlike the PPP or other funding where you have to get a whole bunch of financials. If you don't have a good CPA, you may not get it. You know, this was pretty much based on things like your enrollment, your capacity, things like that. So it was very helpful. And actually the third round of stable grant just came out. So it has been very, very helpful for us to stay open. And then it gave you the flexibility also to designate how you wanted to use it, whether you wanted to use it towards payroll, PPE supplies, however your program needed it to be used, it gave you the flexibility to do that. So that has been very helpful for us.
Who else got grants? Yeah, how did that work for you?
I know personally, we did get the PPP actually twice. We qualified both times, but we also received some local funds from the Monmouth Cares Act. We also received health and safety money. New Jersey also had stabilization grants, which we qualified for. And our building right now, we own it, but our mortgage is through SBA. And we were really fortunate. So the SBA paid our mortgage for 6 months, and they actually just recently did another 3 months.
Oh,
so, yeah, we've been really that's what I did my entire 4 months being home while we were closed. I looked for every avenue possible, and we were, and our local child care resource center was constantly getting us information. And every time I heard something, NJEDA, same thing, like I just applied for everything I possibly could. And we've been extremely fortunate in finding and being able to get funds.
Okay. Nerea, did you nod that you had also had some kind of a grant from the state?
Yeah, so Iowa did, I believe they used CARES grant funding as well, but ours wasn't as helpful. I hate to say that. I'm very thankful for what we got, but ours was based on a monthly stipend. And I believe it started in April of 2020 when the pandemic broke out, but it was kind of complicated. You had to remember to go on. They would open it for so many dates. You had to go on every month and fill out this big survey. And for us, it was only $2,000 per month, which if you're a smaller program, that would make a big impact. But we're a larger program. And so most of that $2,000 per month was eaten up and more with our staffing. So like we weren't allowed to have parents come in the building. So we had to meet them out in our vestibule. We had to take temperatures. We had to do health screenings. So we had to supply 3 runners that we called them. So staff members that would run outside, they would take temperature checks, they'd do health checks, they'd greet the parents, and then they would walk the child to the classroom and come back. So we had to do that for 3 hours every single morning during busy drop-off times, and then 3 hours at pickup time, multiplied that by 3 staff members. So that increased our payroll almost $10,000 by itself. And then when you add in like the extra cleaning costs, the extra staff members, we had designated deep cleaning staff members that would go around and deep clean everything periodically, buying more toys that were plastic and easier to disinfect versus like the cloth toys or the stuffed animals, things like that. So although any amount of funding is like really fantastic, it just didn't quite do it for us. And at that point, the PPP had been exhausted. And so we were running on fumes for a really long time. They did offer an extra $2,000 if you agreed to give your parents a 25% discount on tuition if they were essential, but most of my center was essential. So if I did that, I would have lost a ton of money. So we didn't qualify for that portion, unfortunately. So it was a small, basic kind of monthly stipend, but it wasn't anything that really made a big impact for us.
June, were you able to get grants from the state as a faith institution?
Yes, they didn't discriminate in any way about being a faith-based institution. So the state, it was actually pretty easy. It was all organized by the Division of Child Development. And we received operational grant money for a number of different months. And that was based on your enrollment. And specifically, they looked at how many infants and toddlers you had. Mm-hmm. And we also received gifts in terms of supplies. So twice during the past year, they sent us things like bleach and thermometers and masks, paper towels and wipes. They sent these things to us, each license. Now, you did have to be a licensed program to get these things. Mm-hmm. And then also one time last year, they also supplied teacher bonus money. Actually, twice last year, they supplied teacher bonus money. And the bonus was based on how many teachers you had and whether they were full-time. So you got more if you were full-time and less if you were part-time. Mm-hmm. But that was a big... it was a very big morale booster to the staff.
Yeah. And Angie, finally, you said you did get grants. You kind of put that one on the table. What kind of grants did you get?
Our grants were also through the CARES Act through the state. And it was kind of like Rita, if you were licensed, you got money. And as soon as we had 2 different rounds, and we used that, just tucked it in savings in case something happened. And then of course we did have those 2 times where we did have to close. So we used some of that money to pay payroll for that infant staff area. And we also used that money to upgrade our outdoor equipment because we had some left. And because we had such great parents too, I mean, I have to say that again, they would, they paid even though they weren't coming. They would bring bleach. They would, they'd be at Walmart and see that there were Clorox wipes. So they would grab a pack and bring it to us. So it was really super helpful to have that money and just know we had a nest egg, which we don't usually have, in case we needed it and we did have to tap into it. So yeah, there were no stipulations. You basically got the first one and then the second one just came when more money came.
Okay. I'm going to take a pause here and see, Sarah, if we have any questions from the audience. And I know I'm looking at watching the clock run down and I have a couple more things I really do want to get to. So Sarah, what have we got from the audience?
Yeah, thank you, Linda. There are a few questions. One is around vaccine. Actually, there are 2. The questions are, do you and your staff have access to the COVID-19 vaccine? And are you requiring that your staff get vaccinated to be a teacher in your program?
Okay, Jessica, why don't you go first on this?
We do have access. It was probably about a month or so ago that New Jersey finally approved childcare workers to get vaccinated. My staff jumped on it right away. It was tough getting appointments, but now all of my staff, including myself, are fully vaccinated, with the exception of one because she's pregnant. But yeah, it took a while and it was very hard to get appointments in New Jersey, but once it was available, the staff they wanted to do it, so.
Okay, Angie?
Yeah, we do have access. Childcare workers and teachers were put into Tier 1B with the state of Montana. So mid-March, end of March, we became eligible. April 1st, the whole state opened for anybody over the age of 18. There are 8 of us here, including myself and my co-director. And 5 of us have chosen to be vaccinated. The other 3 have not. And I'm not requiring that for them to be employed here. I feel like it's their personal choice. So.
Okay. Nerea, what about you?
I will also put childcare workers into the 1B category. So we had access really quickly. I am not requiring it. I just feel like we all have our own free choice, and it's just such a demanding job with low wages. I don't feel like I could say, if you do not have the COVID vaccine, you cannot work here. I just don't feel like that's ethically correct for myself. I would say I have 30 staff, and I would say that we probably have between 5 and 10 who did get the vaccine, and the other ones are just not quite comfortable with it yet. And they're kind of just, some of them have the immunity because they contracted COVID sometime during this too. Mm-hmm. So I think they're just kind of waiting to kind of see how the first year or so goes with the vaccine, but no, I'm not requiring it.
Okay, June, how about you?
So our governor here, he actually brought childcare workers forward. So we were eligible, I think, in early April, although because I'm over 65, I was eligible earlier than that. It's my understanding that because this is an emergency medication, we actually can't require it. I also feel that it's not actually sort of right to require people to do this because it is a personal choice. So that said, although I personally would like all the staff to be immunized, I don't think that we can insist on that. And of our staff, we have about 20 people here, and I think there's possibly 6 that have currently chosen not to be immunized because of personal choices. So, yeah.
And Rita, what about you?
Same thing. I am not requiring my staff to do it. 50% of us have been vaccinated, and I think most of the rest of them are like a wait and see type thing. You know, there's so many misconceptions about the vaccine. So, but no, I'm not requiring them to do it. Like everybody said, it's a personal choice. So, and everybody will agree, it's hard to find good help in childcare these days. So if you have them, they're showing up to work, they're doing what they're supposed to do, we cannot require that. And I think, like everybody said, it's a personal choice. So.
Okay. One of the things that I wanted to get to, because as you may have heard, I think that President Biden is thinking about or going to make an announcement on, you know, trying to do something around pre-K. And I know, Rita, Jessica, that you have some thoughts on this in terms of pre-K, and what advice or what are your thoughts as the country moves forward in terms of any implementation of pre-K in the birth to 5 time period? Jessica, do you want to start us on this one?
I would love to, actually. So, you know, I just want to speak personally from our district. It was only just actually in the middle of the pandemic that our district was approved for preschool expansion. It was in February. It was like an overnight thing. So we are a smaller center. We operate on 2 floors. What this will do to us, honestly, because licensing doesn't allow children under 2.5 on the 2nd floor, is it will basically, it could put me out of business. It could completely shut us down because we would only be operational on 1 floor of our building. You know, they immediately outsourced to the local YMCAs. Like, they never even gave us a seat at the table to kind of, you know, show that we are capable and that we can be a part of, you know, some form of community solution for universal pre-K. We are a 4-star rated center for New Jersey Kids Center. We've, you know, we have curriculum. We've worked really hard to get that rating. You know, and I believe that community providers need to all come together and be a part of it. I think it's important that, I think mixed delivery is super important. And I think parents, you know, need to be able to choose where they want their children to go. And just as a center, I think if we're willing to, you know, stand up and do everything that is required of us, you know, I don't see why we don't get to part of that.
Kind of gets back to this, you know, this thing where I think there's a, you know, there's too often this perception that care is different from education and learning, and all of you are providing early learning. There's no question about that. But to be clear, what you're talking about is New Jersey's program and not what, you know, I just want to make sure people understand that that's not what, we don't know yet what President Biden is going to be proposing, but those are good recommendations for people to have on the table as the federal government thinks about doing anything like that. Anyone else want to take that question in terms of what would be the impact on your program of pre-K? Nerea?
Yeah, so I don't know, maybe I'm speaking off here, but my program is a partner site for the statewide voluntary preschool.
Mm-hmm.
So basically, we're within the Davenport Community School District, so they have their own preschool sites, but they also partner with us so that we get to have some of those federal funding. So for example, we have a universal preschool program in my center.
Mm-hmm.
I run it because I'm a licensed teacher. I have my bachelor's degree and I'm fully licensed. So I run that program. And for us, that has been a really amazing community partnership because my parents, I'm sure like what she's saying, we've had the preschoolers that we have now were newborn babies when we very first opened, and our parents didn't want to send them somewhere brand new. They wanted them to continue preschool with us. So this is our first year on the partnership, and it has been really amazing. Our center, like I said, we are QRS rated as well. We're on the partnership, so our parents get a benefit. So basically, if they meet the cutoff and are 4 years old by September 15th, they can enroll in preschool with the Davenport Community School District, but at Birdie's Nest, which is where the kiddos are comfortable. And then the Davenport Community School District basically cuts us monthly funding checks because we get so much per child. The district does from the federal government, and then they take a cut. It's not a huge amount, but they provide us the curriculum and the resources, any special education support systems that we need for kiddos who have an IEP. They bring IEP teachers in, and then we get that monthly check. So this is like I said, it's our first year on the program, and it's just amazing for us. It's been really a valuable tool, a valuable community resource. So I'm hoping that more places do open up those partnerships to early child care centers, especially if they do have someone with a degree and can teach a VPK program. Because for us, it's just been amazing. The parents were so thrilled that they didn't have to transition care from us to a different preschool and then to kindergarten. So it's just kind of seamless. And it kind of creates a special bond and trust with our parents and the local school district where their kiddos will eventually go to kindergarten. So we're kind of like a bridge for the parent and for the school district. And we kind of bridge that gap for them. So they get the academics, but they get their comfortability kind of here with us at Birdie's Nest. So for us, they did, give a seat for us at the table, which was really, really amazing. So we've been really thankful for that.
Anybody else on that one that would like to jump into that conversation?
I would.
Okay.
For the state of Georgia, it's mainly larger child care centers, and because in order for you to have a state-funded pre-K program in your center, you have to have a classroom big enough to hold at least 20 kids, which some of us independent child care centers don't have that capacity. But back to what I think it was Jessica was just saying about continuity of care for a parent, there's a certain level of comfort that says that, okay, I'm comfortable with this center, I'm comfortable with this program, and I would like my children to continue. Because I face that, because of the cost of childcare. When that child turns 4 and the parent has the option to pick a free pre-K program, I have a few that stay with me just because of the comfort level, and then they can afford to stay with me up until their children transition to kindergarten. But majority of them can't afford it, so hey, it's free. They would rather go for free, and sometimes it's not what they want, but because it's free, they go for it because it cuts back on their expenses. So I think my biggest thing is that continuity of care for the child, and especially with now we're dealing with COVID, lots of change. These children are going through so many emotional changes. Wouldn't it be great if they know that, hey, they have another year to stabilize before they transition on to kindergarten, which is, my kids call it the big school, which is, the big school. So I think we should all, I mean, my biggest thing is for the parents, for the families, they should have a choice as to, hey, I want my child to stay in the program that he's been at for 3 years already, since they were infants. And we have a lot of those, you know, so I think if the parents have a choice, they should be supported in that choice.
Okay. I'm looking at the clock and I think we're running right up against the time running out here. So I did prep all of you and say we're going to ask you all this question. You know, we do at BPC get a number of members of Congress or their staff watching what we do. And this is your one opportunity to say to your member of Congress or your senator, what one thing do you think that they can do or should know about you that you would help you as we move out of COVID and move into the future and hopefully stabilize childcare in this country? So I think I'm going to start, June, with you.
Okay, so can I just say, I'd like to just go back on the last question very quickly. I know we're running out of time, and just give a big shout out to Durham County. The policymakers here started a program about 3 or 4 years ago called Durham Pre-K. And this program, if you're a licensed program and you meet certain criteria, they are using private programs now to place pre-K children. It's called Durham Pre-K, and I've applied, and I'm really hoping we're going to get taken into that program, because this will boost our upper enrollment, which is otherwise always affected by, you know, being moved off to public pre-K, which is, you know, free. So that's the first thing. And in terms of what I'd like the Congress to do, is 2 things. One is that we have to find a way of making childcare affordable for families, because it's not affordable for many of them. And the other thing, we have to find a way of paying our teachers a living wage. Those 2 things. And I can only think that some kind of state-sponsored or government-sponsored system is the way it's going to have to work that way, because it's not going to work another way. And thank them too for all that they've already done for us in the past year.
Yeah, you all are a testament to that. Some of what the Congress did do in the CARES Act and beyond really did make a difference for you guys. Okay, Nerea, what about you on this one?
I support what June is saying. I think that childcare workers are grossly underpaid, and unless we want to double or triple our parents' tuition payments, which isn't feasible, we can't support that without additional funding. So for us, like the only funding we really truly get from the state pre-COVID was payments that they made for state aid children, which are very, very low compared to what our actual private paid tuition is. So we need some type of state or federal support. And I don't even care if they give it directly to the employees and we don't even touch it. They just need more. These people have degrees. They have bachelor's degrees. They have 2-year child degrees. They have CDA. They love children and they have the heart. And if we don't support them financially and get their wages up to a respectable and living wage, we're going to lose all these phenomenal people to other industries. And then we're going to get people in that don't have the heart for children and shouldn't really be working with children. And it's going to be a really sad and scary situation. So funding to support quality staff.
Great. How about Jessica? How about you?
Both of your both points I totally agree with. Both of you ladies, you know, definitely, or even a raise in income eligibility for families to qualify for subsidy, you know, so that it's more realistic for working families. But I also think that finding ways for staff to want to stay in this industry, you know, is big. Just again, you know, just to kind of mimic what they were saying, you know, we're working towards trying to encourage our staff to get their CDAs and then go forward and get their associates, and Grow New Jersey Kids helps with that, with scholarship money. But then what happens once they get that? You know, unfortunately, you know, we won't be able to financially keep them. We can't afford to pay health benefits at our level. You know, so finding a way to help get, you know, childcare workers, you know, health benefits, finding, you know, ways to just make them want to stay here and making it financially, you know, beneficial, and, you know, maybe student loan forgiveness, just, you know, just finding ways to make them want to stay.
Mhm.
Early childhood and in private centers like ours, as opposed to being quick to move on because financially we just can't support that.
Right. Okay, Rita, how about you? We have about 1 minute left here, so between you and
Well, I just echo every sentiment everybody just said, because our teachers need support, and I have personally had to experience, students, ECE students that I'm coaching, I'm mentoring. They get their degrees, now they're grown, they have to move out of their parents' houses, but they can't afford to live on their own. So they end up working in an industry outside of childcare just to be able to make a decent living. And for me, it breaks my heart because you've poured your heart into, these students, but you can't really fault them for it because they need to make a decent, living in order to be independent adults in society. So yes, we need more support for our teachers.
Okay. And Angie, you're going to get the last word here.
Well, I have no more words that haven't been said. I mean, our children are our most important aspect of this upcoming world. We need to value that, and we need to have people who can afford to give those children what they need. And it's better pay, it's healthcare, it's paid time off. None of that happens in this industry without some extra help.
Well, I think that was all well said, you guys. I wish we had another hour to talk to you all because you've actually said so much. I think one of the takeaways that I would say is that, and I do think I have to say that we probably need to say as a final thank you to Congress for some of what they did do, because a lot of what you have said would not have been, we wouldn't have been able to do without some of that support. So I think it's kudos actually on that one. And that's something they probably don't hear very often. So anyway, thank you. And, my heartfelt thanks to each of you, because I have been there. I have run a program many, many years ago. It is very hard, the balancing act that you do every day, and you care about these kids and these families and your staff. And I just hope that you all take care of yourselves in the coming weeks and months as we come out of this, because my God, you guys are heroes to all of us. So thank you. And I'm going to get choked up. So thank you all for participating, giving up your Friday for us. And just know that you are appreciated very much by this country. So thank you. And thank you to the audience for tuning in with us. We hope that you have some good takeaways from this and understand just how important this issue is to our families, our children, and our business owners, these people that you've been hearing from. So thank you all, and have a great weekend, everyone.